Thanks, Dan. Intermountain Medical Center surgeons are now performing a complex procedure to treat a rare, life-threatening lung condition. Here to talk to us all about it, about the treatment, is Dr. Mark Dodson. Thanks so much for joining us.
Absolutely.
We really appreciate it. Let's first talk about these life-threatening lung conditions, what they are, and why it's such a big deal.
So this is called chronic thromboembolic pulmonary hypertension, or CTEPH for short. It's easier to say. This is a condition where people get chronic blood clots in their lungs. So you're used to hearing about someone getting a blood clot in their lungs. They get treated with blood thinners. In general, the blood clot goes away. About 3% of patients who have blood clots in their lungs, for reasons we don't understand, the blood clots don't go away, and they block the arteries in the lungs, and that causes high pressure. And that pressure puts lots of strain on the heart, because the heart has to pump blood through the lungs.
And I'm sure it's very uncomfortable and so very scary, but now you have this surgery that's not done very often.
Correct.
But you can have it here. Kind of talk to us about what that is.
Yeah, so it's a very specialized surgery, and for many years, patients diagnosed with this condition in Utah had to go to one particular center in California that specialized in this procedure. And because we were seeing so much of this condition, we decided a few years ago to create a surgical program at Intermountain Medical Center to treat the condition. We started doing the surgeries about 10 months ago, and they've gone quite well so far. And we're fortunate now, I think, that patients with this condition in our community can stay local and be treated.
Which is the ultimate goal, because no one wants to leave their home area when they're having a situation like this.
Exactly.
Now, there's nothing that can prevent the problem in the first place. Talk to us more about that.
That's right. I wish that we could understand why this condition happened. There's a lot of active research going on to get to the bottom of that, so we could identify who's at risk up front and try to prevent it. Unfortunately, we can't. And actually, a lot of data in the medical literature suggests that the vast majority of these cases go undiagnosed. Patients are symptomatic. They're labeled as having something else more common, like asthma or COPD, and the diagnosis isn't made correctly, or there's a long delay before the diagnosis is made, which is unfortunate because the surgery is a very effective treatment for this condition. So
people who might be watching right now, is there something they should be watching out for? Are there different symptoms that should be a red flag to us that we need to get some help?
Absolutely. So the most common scenario for someone presenting with this condition is someone who has a blood clot in their lungs, a pulmonary embolism, and then feels like they don't get back to how they felt before they had the blood clot. So it might be 6 or 12 months down the line and they can't mow the lawn, or they're short of breath walking up the stairs. And a lot of people might accept that that's their new normal, but it doesn't necessarily have to be, because if this condition, CTEPH, is the cause, we can treat it.
And do you diagnose it by doing a chest x-ray, or how do you find that?
It can be difficult to diagnose, which is part of the problem with underdiagnosis, but there's a couple of types of lung scans that are pretty good at catching it. One's called a ventilation perfusion scan.
Interesting, but now we can do it all right here
in
your own backyard and not leave.
That's
Dr.
right.
Dodson, thanks so much for joining us.
Absolutely, thank you for having me.
We really appreciate it. A very interesting topic that we're learning more about today. And if you want to learn more about Intermountain Medical Center and their healthcare, of course, you can visit their website from ours, abc4.com.